Okay, hello folks, and welcome to another episode of Beyond the Finish Line, Navigating the Journey After Residency. And I'm your host, Dr. Joe Sherman, pediatrician and the physician coach. And I'm really thrilled to have with me today Dr. Mike Foti. And Mike has really carved the way to advocate for mental health and mental wellness for physicians. And that's something that is near and dear to my own heart, based on my own experiences of battling with mental illness as a physician, and also trying to overcome the barriers to receiving treatment for my mental health. And Michael is a physician, a professor, a mental health advocate. He's passionate about medical education and wellness. He completed an internal medicine residency at Greenwich Hospital, Yale, New Haven, and later co-founded the Mind Split Cafe Medical School Edition. It's a newsletter and platform dedicated to empowering medical students through wellness initiatives and thought-provoking content. He's also the co-host and co-founder of the Upward Spiral podcast. It's on Spotify and on Apple. And he is also an author, an acclaimed author of the book Grief, A Doctor's Battle with Anxiety and Depression. And Mike, with all of those things, I really don't know where you fit in practicing medicine. So that's going to be part of our discussion. But I'm really thrilled to have you here, and really just want to start out by thanking you for all the work that you've done and the advocacy that you've done on behalf of physicians. So welcome, Mike.
Thank you. Thank you, Joe. And I'm so honored to be here. Thank you.
Great. So Mike, I want to start with just your story. If you could give us some background, first of all, I'd love to start with the Mike Foti behind the white coat, the Mike Foti before medical school and before becoming a physician, because I know that I've heard your podcast and I've read some from your book. And I know that you had an entire life before you even entered medical school. So can you give us a little background on that, and then we'll move into your life as a physician?
Definitely. Yeah, it's a great question. I don't get always asked about, before the white coat. So it's actually much appreciated. I'm a kid from the Bronx, New York. Very much family oriented. I grew up with my older brother, my mom, who's a single mother, raising us with the help of her parents, my grandparents who lived with us as well. First generation Italian American. And it was, like I said, a very much a, family oriented, tight, close knit, youth, where it was very much any friends I had were within earshot, living on the same street as us, and, playing wiffle ball and, on the street corners of the Bronx. I mean, this is what we were doing. And so, that's, I love to laugh, love to be connected with others, and that part has continued to this day.
Wow. Okay. And I know that you are a DO, and and from my experience as a pediatrician and going through medical school on the East Coast, and now I live in the Pacific Northwest in Seattle. Um, there are different reasons why people go to the DO route versus the MD route, and so I'm curious about your journey into medical school and that route of osteopathy.
Yeah, it's a great question. Honestly, I didn't learn about osteopathy until um, learning about it from my pre-health advisor in college. I had just taken my MCAT. I was a bit distraught at the score that I received. It was not up to my standards, at least. and I spoke to my pre-health advisor, and he told me, he said, Mike, there is this other route, osteopathy, and obtain a DO degree, and their admissions process, as he put it, is a bit more holistic, not looking just at the MCAT score, but everything else about you. Your GPA, I was a near 4.0 GPA in undergrad, and all the things you do, your extracurriculars, and then you as a person. And that's something that you might consider. And being in the Northeast, there's several, DO schools here in the Northeast as well. And so I did my research, and not just the admission process, but I love the holistic nature of patient care and the approach to patient care that I learned about just reading about osteopathy online. And so I was further kind of encouraged and motivated to apply, and thankfully got into my first choice, NYIT, College of Osteopathic Medicine in Long Island, New York.
Wow. So you weren't too far away from home when you went to medical school.
Quick 30-minute drive over the bridge.
All right. And tell us a little bit about, especially in light of your passion now as you practice medicine. It's kind of, you have several different passions and different activities going on. And as you made your way to through osteopathy school, and then you decided to enter into internal medicine residency, how did all those choices? What went into those choices?
Yeah, a lot of that went into the fact that my clinical experiences uh, had really had a profound impact
Mm,
on, and many of which were in the primary care setting. So I knew how important a role the primary care physician was. So that's where it started. And I said, I know it's going to be a primary care field, which I don't know, but I know it's going to be primary care. I loved the being an advocate for your patient, being that number one, and being able to, form such a wonderful rapport and continuity of care. So again, this was seen in my mentors, as well as, actually, one of my uncles who, practiced primary care and internal medicine for, I want to say, at least 40 years. So, I had some experience with that. Then going into clinical rotations, internal medicine became solidified for me. And, I very much enjoyed the medicine of it, the analytical nature of it. I loved rounding, and, I knew when my peers were like, "Oh, I can't take these 2-3 hour long rounds on the wards." I loved it. So I knew that was for me for sure.
wow. And going through medical school during that time, were you single? Did you have a partner, or did you have a family, or what was your situation personally?
Yeah, I did. I had a girlfriend who I had been dating since I was about 17, 18 years old, and happy to say we got married once I graduated medical school in 2019. So we've been married now. It'll be 6 years in June, and we've been together about 16 years total.
Wow. Well, congratulations. That's a
Thank you.
feat in and of itself.
Thank you.
Um, and so now you enter residency, I believe, in 2019. Is that correct?
That's right.
Yeah. So obviously, March 2020, I'm up here in the Pacific Northwest and in Seattle. We started to hear about this strange, at the time, Chinese virus that was around. Uh, and I kind of feel like, I know I had a daughter at the time, a 16-year-old daughter at the time, who was in Argentina studying abroad in high school. And it just seemed at the time that we in Seattle knew about something wrong, something dramatically wrong, and that the rest of the country was kind of oblivious at the time. But soon, everyone else heard more and more about COVID. So take us through your journey through residency and the struggles, the joys, the challenges. What was that experience like?
Yes, training in the Northeast, we didn't have that period of hearing about it. We heard about it, we saw it right away. So it started out as uh, more and more patients getting admitted with this very intense viral pneumonia. And the initial knowledge was, well, from what we know about viral pneumonias, especially those with like who develop influenza, likely this is going to be very devastating for our elderly population, and so this was our initial thought. But we started seeing young people come in with this. Then we started seeing people in their 30s and 40s coming in with very, very intense viral pneumonias, dense infiltrates all over their lungs, requiring significant amounts of oxygen. And so, on that side of it, because we were very much involved in all the conversations and the town halls and different meetings with our infectious disease doctors and pulmonologists, that was very strange to us that that was happening to such young folks. And so, on the residency side of things, so on the GME side of things, it was okay, we're closing down the clinic. If you're on electives, you're no longer on elective. We now have COVID team one, COVID team two, and then what we call the quote unquote non COVID team. Uh, but very swiftly, weeks into it, not even the non COVID team existed anymore because there was really no one in the hospital without COVID. So now we had three COVID teams and going from one ICU to two ICUs very quickly. And I'll tell you, the atmosphere very, very quickly became very much akin to a war zone that a hospital or healthcare facility could be.
Wow. I just, I think about my residency and it was in pediatrics. And I mean, the pediatric residency is hard. You work hard, you work these long hours, you're exhausted, you're pushed to your limits. But at least in pediatrics, we had kids and we had kids we could pick up, we could play with. We saw kids come into the hospital, normal kids with serious infections, meningitis, sepsis, and then they get treated and they walk out like normal kids again. And I just think about going through residency with everything on you, all the masks, all the, the gowns and everything that separates you from not only patients and families, but also your colleagues and any support that you might have. And so I imagine the stress level was exponentially worse.
On many levels, so it was what we were witnessing, right? So these were young people in their 30s and 40s perishing. These were loved ones in the hospital at the same time, separated by a distance of a hallway, perishing in the hospital due to this illness. Um, and the inability of families to come and be with their loved ones when they would pass away. It was heartbreaking on that respect. Then it was the self awareness of our own mortality, walking into that room, room after room, and something you really had to leave at the door. But obviously, there's that worry that what if I get this? If I'm seeing people my age dying from this, I could very well easily die from this as well. And so it was compounded by that thought as well.
Wow. Wow. So I know that at some point you really, I mean, you write your book and you've talked about it in your podcast and you've done other writing about it and appeared in other podcasts and public forums about your struggle with anxiety, depression, and the impact of that entire experience on your mental health. So, can you expound on that a little bit more?
Yeah, it very much came after, almost in kind of like a post-traumatic stress disorder type of fashion, after I graduated residency, actually. So, again, during residency, it was the devastation of the pandemic. This was compounded by the sudden passing of my mother, who died within 2 weeks of being diagnosed with stage 4 lung cancer, very unexpectedly. Um, and again, not being able to grieve her loss because I was right back in the hospital, not even be able to grieve the losses of the patients that were dying each and every day as well. Again, now I'm only attuned to this now, right? At the time, it was not. I graduate residency. I start my first position, actually as a residency preceptor at an internal medicine residency program, and daily panic attacks waking me up every night, the most unbearable sensation that you can imagine, as if someone was trying to rip open my chest, squeezing my arms off my body and my legs off my body. Really an unbearable sensation. Um, and then daily anxiety fluttering in my chest. And the fact that it continued for months, I was blaming it very much on the job, as if, type of an imposter syndrome type thing, that I just couldn't do this, right? And that led it to become quite the severe depression, where I was really just hiding away from my family and shuttering away from them, and because I was so ashamed at the fact that I felt that it just amounted to me not being able to be a doctor, and
Wow.
yeah,
Wow. You bring up so many. I mean, you talked about number one, this whole idea of experiencing what the amount of trauma, all of that vicarious secondary trauma just coming in, and I mean, direct as well as secondary, but also this idea that instead of having what I am for myself realizing, well, a normal human reaction is like, wow, I'm really suffering here. This is really hard. But no wonder, look what I've been through. So this is extraordinary. This hasn't happened in the history of humankind. So obviously I'm going to need some help. I'm going to need to to do something about this. But instead there's a culture that we have as physicians that, and again, I don't like to generalize too much. I'll speak from my own personal experience, where it's a sign of weakness. It's, you don't really reach out for help. You kind of tough it out. And this is kind of what's expected of you. So if you're going through this, perhaps there's something wrong with you. Perhaps you're not strong enough. Perhaps you're doing something wrong. Maybe looking around, everybody else seems to be okay. What's wrong with me? Um, and then this idea of, oh, well, I'll just make it better in some magical thinking, or it'll go away. That's just fascinating. Can you tell me more about your reaction, almost that second arrow of, yeah, I'm suffering, but I shouldn't be suffering?
that's right. I mean, a lot of this was asking myself, why is this happening to me? Why am I going through this? I should be able to do the job, and that thought that you so eloquently put it as, of course I would react this way, right? That was actually told to me months later by the first psychiatrist I'd ever speak to, right? And it was a thought that never crossed my mind. Now I know it due to the stigma that you're speaking of, right? That delayed my care. But it wasn't until I had the worst panic attack of this whole cycle that led me to the emergency room, all the testing, of course, being normal, and finally seeing a psychiatrist who sat down at my bedside and said, again, well, of course you're reacting this way. Look what you've been through over the last 3 years.
And that, so you, it took you to be in the hospital, to be in the emergency room, and to have this evaluation. and the psychiatrist actually coming and seeing you in that moment. And I'm very curious about that initial reaction you had when this someone else who was a physician says to you, of course you're going through this. This is what's happening to you. This is not a brain tumor. This is not MS. This is not. The reason I say all these things is because very similar experience I had coming out of residency, losing both my parents as a senior in college within 4 months of each other. And then my reaction was keep going, go with the plan, don't stop, because if you stop, you don't know what will happen to you. No one around suggesting I stop or anything. Moving on through medical school, moving on through residency. There's plenty of work to do, plenty of things to avoid, grieving and avoid all of that, until finally getting out into practice when I started to have numbness, headaches, panic attacks, the same types of symptoms. And I was convinced I had MS. And I went to my primary care physician and I said, I'm scared to death. I have a brain tumor. I have MS. I'm all numb on my right side. Something's wrong with me. And he did the MRI and he said, I really think that this has to do with stress and anxiety. And I'd love for you to see a psychiatrist. So for me, there was a mixture of emotions. I have to say there was some relief in there. And there was also some shame. There was some sense of weakness, some sense of disbelief. What about you?
All of that. If you're gonna hit the nail
Mm,
on the head anymore, yeah, it's initially it was relief because I saw that perhaps there's a light at the end of this tunnel. That this wasn't just I can't do this. The fact that this could be attributed to the trauma that I had experienced had never crossed my mind until the psychiatrist brought it up to me. So when she first came in the room, it was she's wonderful. She doesn't even know the impact she's had on my life, but instead of asking those questions that we've all heard on our psychiatry rotations, she just asked about my life and it got to all of that. And that's all she needed to hear. And so yeah, the initial reaction for me was relief in that there was something we could do about this that could get me back to medicine. The other part of it though, yeah, of course, was I felt weak, I felt guilt, I felt that um, I was too weak to be able to provide for my family in that moment. Um, and I had to suck it up and say, you know what? Even if I do need to take a leave, which I did take a medical leave, I need to do what I need to do to get myself better for my family. I had a son at that point. Now I have two kids. I was
wow.
like, I have to do what I need to do, no matter what else I'm feeling, to get myself back to Mike.
Wow.
And that's what I did.
Wow. Well, I have to say that takes a lot of courage. It takes a tremendous amount of courage to do that. Um, can you tell us a little bit more about your journey to wellness from there?
Definitely. Yeah. So, as I mentioned, at that point, I actually had switched jobs. I had gone into general primary care because, again, I thought it was the job. I thought
Hmm.
maybe precepting was too much for me. And now, obviously, as we know now, it's not. Um, and so I took a leave. I signed up for weekly sessions with a psychologist, and I was started on the antidepressant medication by my primary care doctor. And for the next 3 months, I was seeing a psychologist every week, undergoing cognitive behavioral therapy. I'd get homework with the workbook, go see the psychologist in her office, and again, I was on the medication, the antidepressant, and slowly but surely faced this head on. And by March the following year, it was like I was back to playing wiffle ball in the Bronx again.
Wow, what a story. So And I mean, have you continued to have to be careful about your mental wellness and taking care of yourself since that time?
Yeah, I've still taken different opportunities for that. Whenever I feel the need that I need to speak to someone, I do. I've even undergone coaching sessions and whatnot, and it's been great for my. Yeah, I'm actually going to be undergoing another coaching session soon. So I'm always on the lookout for any triggers or anything for me that I don't want any setbacks, and so always looking to grow personally and professionally.
Okay. What was it like for your family? What was it like for your wife and your son at the time um, to kind of see you go through this?
It was tough. It was tough. Quickly for my son, thankfully he was young. He was about a year old, and at most it was. And again, this added to my depression before I really got into my treatment. I could still recall him calling my name, "Daddy, Daddy," and I was, shuttered away in my basement because I was too ashamed to look him in the face. It was, he and now my daughter are my whole life. So that was tough. But thankfully, I think he was a bit immune to a lot of it. It was my wife that took the brunt of a lot of this. She had to pull extra work. She used to work full time. She's working remote part time now. And, she put in a lot of work in that on top of the fact of just being my rock and being my support system. I owe pretty much all of this to her. And she went through her own struggles. Both of my children, we conceived through IVF, and my wife went through, multiple miscarriages before that, and during that to bring our two children here through IVF. So she had her own struggles and battles while having to be my rock. So she's a saint for sure.
Wow. Yeah, I have to say that the partners and the families of physicians are a special group of people that I think, I don't know whether it's the selection of who ends up going that route in their lives to become a physician or whether it is the programming we go through of what we're supposed to be doing, how we are supposed to respond, how we're supposed to react. That does it. Maybe it's a combination of both. Yet I feel like um, I know for me, and I'm of a different generation. I'm of the generation where the rest of society kind of puts us up on a pedestal and tries to make everything around us fit our lives. And that's other struggles to try to deal with. But I really believe that there is a special place for families of physicians to be honest with them and to support us and to really help us to work things out in a way that perhaps deprograms some of the programming that we receive from all of that training.
Oh yeah. I mean, and again, this was after she had been there for me through the loss of my mother. This was after she had been there for me through a pandemic, right? So this was yeah, no, I totally agree. Anytime someone, very jokingly would say, "Oh, you're a doctor's wife," she very quickly stopped them and say, "Listen, this ain't all sunshine, so I don't think it ever is, and so yeah, totally agree. There needs to be, open communication and transparency, and because they wind up being your rock through a lot of things.
Yeah. So tell tell us more about your life now. You've written this book, and you know, I've been a pediatrician for 38 years, I think, and have had a variety of different jobs and have learned a lot of life lessons through a lot of failures and trials and errors. And I always think maybe someday I'll write a book. And yet I've never had the courage to do it. I don't know, or think I had the ability. Yeah. So tell us about the book and then about your current work.
Definitely. Yeah. So the book was it was born out of a lot of journaling I had done initially. You know, my psychologist said, you need to just write this down, these experiences that are haunting you, that are triggering a lot of this for you. You need to write them down. And in writing them down, it'll take the burden off of your, kind of mental state. And so I did. And then once I started at my current institution, which I'll get into, and started talking about all of these things that we've been talking about today, and seeing the impact of my story just on, medical students that were here, I said, well, if I can have such a profound impact with my story on a group of maybe 20, 30 medical students, imagine what my story could do for so many others. And I figured the the best way and the quickest way to do that would be to get my story out there as a book, to really get it to medical students across the country. And so those journal entries really were the basis and the kind of skeleton of the book, upon which I expanded and really just told my story. I talked about, the patient stories that really had the most profound impact of my time on the front lines of the pandemic, and the loss of my mom, and really how, my journey to recovery.
Wow. Wow. And so you write the book and and imagine you working full time as a primary care internist.
So I'm actually in academic medicine now. So I switched over a bit, and I started out in academic medicine, really, as I mentioned earlier,
Right.
and then I switched back from general primary care into academic medicine. So now I am full time as a clinical assistant professor of internal medicine at the Toro College of Osteopathic Medicine in Middletown, New York. So I'm actually not practicing at the moment. I haven't practiced now for almost 2 years. And not that I don't have the option to, it's very much built into my position that I can get a day of clinical work if I'd like to. Uh, but honestly, I always knew I wanted to teach and have it be an aspect of my career, but I've fallen in love with teaching so much that I don't at all miss practicing at the moment. I really enjoy the mentoring and the teaching of clinical medicine to our students, and it's been a wonderful journey over the last 2 years.
So your job now is full time teaching. Is that
That's right.
correct?
That's right.
Wow. Wow. That's and so I have a couple of questions. I mean, I could talk to you forever because there's so many parallels. But thinking about our audience and thinking about people making decisions, um, one thing is you mentioned this about kind of like one of the moves that you made was you changed jobs. And I know for me, when I was in that first job that I had out of residency, I thought I had to quit medicine because I was so bad off. Fortunately, I was volunteering at a clinic where I felt my heart really lied, not so much in private practice, but was more in community health. And the people there were more nurturing to each other as providers than the folks that were in private practice. How do you know if you are in a position, whether it's the job or whether it's me?
It's a great question. One thing, again, I tell this to my students, I tell this to anyone who asks me about this. Whatever you do, it's never worth being miserable, right? So I know that the job that I have now is something that I've really always been truly meant for, because I wake up excited every day to come into work. I don't have I don't know if you've heard of this, or the Sunday scaries. I don't have those Sunday scaries coming into work on Monday. If anything, I look forward to it. And yeah, of course, there's stresses, like every job has stresses, but I love it. And yeah, is there a little bit of guilt that I don't practice medicine? Of course, because I put a lot of work into that. But it's so rewarding what I do. How grateful my students are for the time I put into being here and the time I spend inside and outside the classroom mentoring and teaching them. This is the best job I could have ever asked for. So no matter what you do, no matter how many times you have to switch jobs, don't ever stay in one place if you're miserable.
I love that. You know, my clients that I coach, one of the hardest things for them to do is to have the courage to quit a job and to move on somewhere else. Um, and I also say, wherever you go, there you are. So you do take yourself with you. So it's not, sometimes it is the setting, and finding the right setting is important, but also making sure that you're taking care of yourself and you understand yourself as you move on to that next step. Can you also say something about support needed, or that you believe is needed as you go through medical training and as you emerge from medical training in the beginning of your career? Um, do you believe that we as physicians, residents, and then as physicians, fellows, whatever, do you believe that we should routinely have supports in place to help us with our mental fitness?
100%.
Mm-hmm.
100%. And again, I am in favor of, specific resiliency training, from medical school and beyond. But more than that, and I speak about this often, you might have heard me say this and others might have heard me say this, but I believe that from medical school to residency to attending life, there should be dedicated healthcare professionals, mental health experts for our medical students, our residents, our fellows, and our attendings. How can we be surprised that in one of the most demanding, high stress professions, that we would not be prone to the consequences of chronic stress being anxiety, depression, etc., right? So why this is a surprise, why this was ever looked as a weakness is beyond me, as if we were expected to be superhuman. Well, let's say we're not superhuman. We are human. We are just as much, and I say this often, I might have said it in the book, we are just as much human as anybody else, and we must normalize the human experience being mental health for medical students, residents, fellows, and physicians. And the way that we do that first is what we are doing right now, Joe, speaking about it, raising awareness to help remove that stigma. But then also there needs to be systemic change, right? Again, dedicated staff at every institution from medical school and beyond, legislative change, which is happening at the moment, and so on and so forth.
And thank you very much, because I'm a strong proponent of that. And one of the barriers that I know that I hear from people are the questions in state licensing applications, or hospital privilege applications, or faculty applications that ask about mental health, or addiction, substance use, whatever it might be. Um, and people are afraid, physicians are afraid, if I seek out help, then somehow I'm going to get my license taken away, or I'm not going to get admitting privileges, or something else like that is going to happen. Can you speak a little bit to that, the fear of consequences?
Well, it's normal, it's natural, it's something that I even looked into myself. One thing is that anxiety and other mental health disorders are listed as a disability under the ADA, and as such, you don't need to disclose any disability. In terms of the licensure requirement question, I am part of an organization called the Dr. Lorna Breen Heroes Foundation. I'm an ambassador for that organization, who are actively working, going state to state to remove that licensure requirement question, because for that exact reason, being that it's completely unfair, and just because a physician has dealt with mental health in the past does not preclude their ability to be able to practice medicine in the future.
Yes, I know that I've been on podcasts and I'm a big advocate. I say that they should change the question that says, have you ever received any treatment for your mental health? If not, why not? And that the answer should be yes, I have, in order for people to know that given the stress of the job, that someone does have support and that they are seeking help because it's absolutely essential. Absolutely essential. Um, so I don't want to force people into things, but I do think that this is something that should be available, normalized, and should be part of our culture and what we do as physicians. Um, and I just want to kind of like start to wrap this up and thinking about folks that are out there, folks that maybe they made it through medical school, they made it through residency, they finally have their first job, and all of a sudden they're not working 100 hours a week or whatever it is. And now they're saying, I'm not sure, I'm struggling a little bit. I'm not really sure if I'm in the right place or if I just need help. What advice do you have for them?
Yeah, I mean, if you're unsure you need help, you probably do need to speak to someone, right? I think that's a great way to go about it. It's better to be safe than sorry in that respect. I think that remembering, the phrase that I'm sure has been tossed around quite a bit now for good reason, in that it's okay to not be okay, right? So, getting that help, speaking to someone, and then determining, is it the job? Is it something that can be worked on internally? And then, maybe it's not the job itself. That's something to figure out, but never be afraid to, like you mentioned earlier, move from another job if you need to, right? I'm in my fourth position since residency, in 3 years, but I've been at this position for 2 years and I love it and it's been great, right? So it's okay. You sometimes you just have to find that right position for you. And again, I always say it, no job is worth being miserable for, no matter what. No matter the salary, no matter the accolades, no matter the credential, no matter what, nothing is worth misery because we spend more time at our job than we do at home. It's best to be happy.
Absolutely. Absolutely. Yeah. I think in my 38 years practicing as a pediatrician, I've had at least 8 or 9 jobs. Never had the same job more than 5 years. Some of those were really bad fit for me. And sometimes life took me elsewhere. And my wife had an opportunity. We decided together our family needed to live somewhere else. It is more the norm now, I think, to move around than it was back when I first got out of residency. So I was a little bit of an outlier, but I do believe that this is more, people are more aware of this. And I think it's a good thing. I think it's essential. Um, okay, my last question for you, you've been so great at answering all my questions, is that if you could go back and if you did not go and take this route in osteopathy and internal medicine and an advocate and a podcaster and all of these other things, what would you be, do you think?
I'm going to kind of cheat a little bit on this question in that I'd still be a teacher, but maybe not have gone to medical school.
Yeah,
I might have gone, maybe gotten my PhD and perhaps in physiology. I really enjoy physiology as a subject. And maybe I've gotten my PhD and gone that route and then gone into teaching in this field. I think that's something probably for sure. Definitely teaching no matter what, but maybe not have gone through medical school to do it. Not that I regret it because now I'm teaching what I learned anyway, so it's not wasted knowledge in any sense of the word. But yeah, I'd probably do that.
great. Awesome. Well, Mike, I really appreciate your time here and appreciate all you do. Absolutely. You're touching the lives of so many people. You may not be doing clinical patient care right now. Uh, who knows what you're going to be doing in the future? And I would say that you're touching so many more lives by teaching those young medical students who will then go touch other lives. So thank you so much. And tell us about how people can get in touch with you, learn more about what you're doing. Now's your time.
Thank you. And thank you, Joe, for all that. That was very nice. Thank you very much. Yeah, if you'd like to check out my book, it's called Grief, as you mentioned, A Doctor's Battle with Anxiety and Depression. It's on Amazon and Barnes and Noble. My podcast, the Upward Spiral Podcast, is on Spotify and Apple Podcasts, and we have an Instagram, the Upward Spiral _podcast. I'm on Instagram, Dr. Foti129, and I'm on LinkedIn as well, Michael Foti DO. So please reach out.
Awesome. All right. Thank you so much for being with us, Mike. Maybe I'll have you back. This has been quite a conversation, and I look forward to further conversations with you professionally, informally in the future. It's been great to get to know you.
Thank you, Joe. Likewise.
All right. And thanks everyone else for joining us today on Beyond the Finish Line, Navigating the Journey After Residency.